Hi class, and welcome back to our last Intro to Psych lecture. Today we're going to cover Chapter 13, Treatment of Psychological Disorders. And to do that, it really builds right off of our Chapter 12 lecture, which comes down to the fact that we have to think about how we're going to treat the disease or treat our problem based on the source of the problem. And if you think back historically, if we thought that this was due to magic or demons, we called an exorcist. Worked for as well as it did, right? If we think this is a biological cause, if we think that your cause of depression is due to your neurotransmitter imbalance, how are you going to treat that? Well, you're going to use some kind of maybe a drug, for instance, right? Like a biological treatment. So psychologically, if you think that your depression is caused by your negative thoughts, chances are you're going to think that therapy might be useful. More broadly, we can also think about not just family, but other cultural, societal causes, right? Where maybe we think about this not just a therapy of an individual, but maybe group therapy or community psych. So, well, we've kind of taken out the magic and demons option here, and we could almost put psychological and sociological causes together. And that leaves us with really two types of treatments: psychotherapy and biomedical therapy. So when we talk about psychotherapy here, there's a lot of different people and they all have different names attached to them, right? And so let's kind of clear this up for us. So, right, when I tell people I have my doctorate in psychology, one of the things they ask me is if I can prescribe medicine. And I say, no, I am not a medical doctor. I am not a psychiatrist. A psychiatrist is a doctor, right? I am a correct you doctor. That's a fix you doctor. That's somebody who specializes in the treatment of mental disorders who has gone through a medical program. Right? They're able to prescribe medications here. Now, you also have clinical and counseling psychologists. So these people are going to have a doctorate in clinical or counseling psychology. Right? When I tell people I have a doctorate in psychology, they say, "Oh, so you're a therapist?" And I go, "No, that's not me. I just study what people do." Right? My doctorate is at, right, it would kind of be wrong for me to say I'm a psychologist because people would think, "Oh, so you do mental health." No, I'm a social psychologist, right? But these people can't prescribe medication. You also see a master's degree level of professionals here. So licensed clinical social workers, marriage and family therapists, LPCs, licensed professional counselors. I'm going to let you in on a secret. There is no major difference between a clinical and counseling psychologist with a PhD and a clinical counseling master's level professional, except for how much schooling they've gone through. Sometimes you will have really great clinical counseling psychologists. Sometimes you'll have less great ones. Sometimes you'll have great master's degree level individuals working in the field. But all of this is compared to people like Dr. Phil, quacks who, don't actually have any good, valuable things to say about this with any sense of accuracy, we'll call it. And so with this, though, with a psychiatrist, chances are you're only going to meet with them for 5 or 10 minutes, just like you would with your general practitioner, a regular doctor. But when it comes to these different types of psychologists and therapists, we think about this as psychotherapy. And so the treatment of mental disorders by a psychological rather than medical means. Talk therapy, you might call it here. This might be a 30-minute to an hour-long session, totally depends on the person. It can be short-term or long-term. You might go to therapy for a couple of weeks, you might go to therapy for a couple of months, you might go to therapy for a couple of years, depending on what needs to happen for you. In the same way that if you had an issue with your leg, right, you would go to physical therapy until it got better. I always mention this, which sounds kind of stupid, but if you didn't like your dentist, you would change dentists. If you didn't like your therapist, you should change therapists. There are good therapists and bad therapists out there. If you don't like them, that's fine. Change with them, right? And also, if you go to a therapist, don't expect this to just immediately like, "Oh, thanks, I'm cured," right? Some therapists work better for different people. So an example of a question you might have is that if my dad tells me that a friend of his has been diagnosed with schizophrenia and he says, "So can you prescribe him medication, son?" I'm going to tell him, "No, you need to go see a psychiatrist," right? Somebody who can actually prescribe medication here. Now, what I'd like to do is talk about psychotherapy in the sense of different traditional fields. If you go to a psychotherapist, if you go to somebody, a counselor, and you ask them, what is, right, like what kind of perspectives do you take? They're almost certainly going to say all of these and some pieces of them, right? And so we're going to talk about three major perspectives that really fit in with what we talked about in personality. The first one is the Freudian psychoanalytic perspective, the idea that, as Freud mentioned, people are driven by sexual and aggressive instincts. And so what we do is that we are going to look into your psychic conflicts, explore your childhood, and figure out why, your id is wanting to fight your super ego and why your ego is having trouble with this. The therapist in this role is considered a neutral expert. And so what they're going to do is actually sit on this chair behind you, have you lay out on the chaise lounge, and this is Freud's actual chaise lounge, right? He'd have you sit here and he'd ask you, so tell me about your childhood, or tell me about the conflicts you're having this week. And what he's doing is trying to understand that in the sense of, oh, maybe you're just really repressed about something that happened in your childhood. Some of this is total BS, right? Some of this is completely ridiculous. But Freud brings up a really important fact that, if mom and dad were pretty mean to you as a kid, you probably had some negative issues that might impact you later. But we need to figure that out and find that by looking at your subconscious underneath here. So how do we get into your unconsciousness? We could hypnotize you. We could look at your dreams and ask you what you dreamt and what we think that means. The other one we often talk about is free association. So we think about that as, think of the first thing that comes to mind when I say a certain word. So if I said the word peanut butter, the first thing that probably comes to mind is jelly. But if I said mom, what if the first thing that comes to mind that you say is anger or like hate? Well, maybe we're getting somewhere, right? That's what Freud would argue. So also this idea of Freudian slips, this idea that maybe you say one thing when you actually meant to say another, right? Imagine if you called your current significant other's name, you called them by your previous significant other's name, right? If you screwed that up, that might be considered, Freud would say, oh, maybe you're thinking about your old significant other, this kind of thing. Problem is, there's no research that says all of our motivations are due to wanting sex and being aggressive. But the interesting thing with psychodynamic therapy is it's useful. It still actually has been found to be good for people with anxiety disorders, dissociative disorders, even in adjustment in one's life. But one important thing I always mention here is that the person who is getting the psychotherapy, the client, needs to be intelligent and verbal. And so what we mean is they need to be willing to work with this person and be thinking like, oh, these are my thoughts and this is how I'm feeling. Not just like, I'm sad. Well, why are you sad? I don't know, right? Like being helpful in that case. So psychoanalytic therapy, or first kind of therapy, says like, well, maybe we can just kind of treat you based on whatever screwed you up in childhood, more or less. Our second type, going back to humanistic and positive therapy, one of my favorite types and is more or less used by most therapists today. This is the idea that people are naturally trying to be healthy, right? We're trying to think of them positively. We want to grow. It's not in our nature to sit down and be depressed all day, every day, right? We want to gain and grow in this hierarchy of needs. We need to become self-accepting of who we are. We need to basically kickstart this natural growth tendency here, right? This kind of explains why a person is going to, go and achieve. And the therapist here, instead of saying like, oh yes, I know so much more than you because I am the expert, the therapist here is going to treat you and the other person as equal, right? You and themselves as equals here. And this is person-centered therapy. The idea is that growth is facilitated by accepting the other person and being genuine. So, right, we talked about this idea of unconditional positive regard. If you go to a therapist and you tell them, like, I'm cheating on my significant other, they're probably going to say, well, that's probably not a good thing you should be doing. But they're not going to sit there and go, oh my God, you horrible person, get out of here, right? Like, they still are going to be nice to you and care about you, that they accept who you are, even if you do bad things. And think about how good that is going to feel for a human being to help them feel connected. Empathy, understanding the emotional experience of a client, right? While maybe on this, on one hand, I can't know what it's like to feel pregnant, I could understand maybe what some of those feelings would be like. And then this idea of authenticity. So tolerating differences without being judgmental, being completely open and honest about your response. So, even saying like, I don't think it's a good thing that you cheat on your significant other, but I'm still happy that we're chatting. So this is a really positive type of therapy that is arguing like, how can we do best for you? And so, right, if your client here is saying things that, like, I wish my expectations were lower, I keep thinking about next year, it's getting me going, you can see that this person might respond with empathy, saying, wow, that must feel tough when, it sounds like there's other things you can do to feel better. Or this idea of authenticity, if your client comes in and says something like, oh, I know you don't really like me, this is stupid. Being authentic and saying, I enjoy our time together. Maybe I should tell you that more so you feel that way. Again, showing this authentic side of you. It's very hands off though, right? When this person comes in, you kind of, right, as a therapist, you're just going to say, hi, how have you been this week? Or how have you been since the last time we saw you? And then let it go from there, right? There's no major experimental research on this actually. And again, clients must be able to kind of understand their problems and explain them, be willing to talk them out loud. It is really good, though, for marriage counseling, for people who are having trouble with careers. A lot of psychological disorders will use this as a component as well here. So humanistic and positive therapy, I like to think of it as like kind of the opposite of Freudian psychodynamic therapy. However, they're still going to argue things like your childhood matters, right? That's not being taken out of the equation. Lastly, of the psychotherapy types, we have cognitive behavioral therapy as well as the split of the two, behavior therapy and cognitive therapy. And so some of this is going to sound a lot like what we talked about with learning because behaviorism is kind of the basics here. People's actions are based on learned patterns that we have conditioned people to do based on their past experiences. That's just B.F. Skinner. That's classic Skinner stuff. You know to raise your hand to ask a question in a classroom because you've been conditioned to do that based in the past. So, can we change your negative behaviors? Probably, right? And we're going to argue that the therapist in this case is doing the same things that a coach or a teacher or a trainer would do, right? And so this idea of behavior therapy, we can change bad behaviors to more constructive ones. We can use behavior modification. I've modified my daughter's behavior from going potty in her underwear to going potty on the potty, right? Reducing emotional responses, we can do this too. Thinking about things like phobias. So if you have a phobia, a fear of spiders, we can expose you to spiders in two different ways. One is we can use a graded, kind of a systematic desensitization way of doing this, right? So if you're really scared of spiders, maybe the first step is we put you in a room with a picture of a spider printed out, a picture of a drawing of a spider. So we start really slow, right? Like if you're going to teach the idea being like if you're going to teach a kid how to swim, maybe you start by putting their feet right in the very little bit. That means the other option for exposure therapy is you throw them in the deep end. Oh, you're scared of spiders? Let me throw some spiders on you or lock you in a room with a bunch of spiders. That could work. Could use systematic desensitization or this other way. Right? And the idea is that you can change behaviors this way. Maybe you're like me and bite your nails. My parents in the past used this bad tasting nail polish that was clear on my fingers that every time I bit my nails, it tasted bad. It didn't actually stop me because I thought it tasted good. Oops. Another type of behavior therapy you might remember from your childhood are token economies, sticker boards, right? If my daughter does a good thing, she gets a sticker. So that helps her to realize, oh, maybe I shouldn't freak out. Maybe if I don't have a tantrum, I'll get another sticker. And now I've learned how to manage my behavior. So that's behavioral therapy. On the other hand, we have cognitive therapy. Cognitive therapy is the idea of focusing on your thoughts, identifying and correcting distorted thoughts about yourself or the world, thinking about those attitudes and cognitions that you have towards yourself and others. The idea is you're wanting to restructure the way you think about something, replace bad negative thoughts with better thoughts. So, right, imagine the situation where a friend walks by and they don't see you, right? They don't acknowledge you. You waved at them and they don't notice you. One way you can think about this, one thought you can have is, wow, they hate me, right? And you're going to feel bad there. What if you changed your thought pattern and said, well, maybe it's not that they didn't see me, right? Or maybe it's that they didn't see me. Maybe it's not that they ignored me. Then all of a sudden, that's going to probably make you feel a little better. One thing we can do is talk about stress inoculation training through this. So right, many of us imagine the anxiety that things are going to happen in the future. Oh no, I'm going to have to give a presentation. Well, what we can do is just like we give people shots and vaccines to inoculate them, to keep the bad thing away by learning what it is and fighting it off, maybe we could imagine the negative situation and imagine how we could handle it. So the idea here, and I actually jokingly use this in my class when people have to give presentations, I say, let's think about the most worst case scenario. Do you think I'm really going to throw you out the window? Right? And then people go, no. And I go, okay, so how stressful could this really be? So stress inoculation training is the idea of maybe putting yourself mentally through whatever you're going to do and saying, see, it's not that stressful. Again, cognitive therapy is the idea of replacing your emotions, but it's easier said than done. Practicing self-compassion, being kinder to yourself, is not the easiest thing. So what happens when we combine cognitive therapy and behavioral therapy? Well, we get the most used type of therapy there is, cognitive behavioral therapy. Cognitive behavioral therapy is exactly what it says. We are focused on changing your cognitions, your thoughts, which help to change your feelings, which help to change your behavior. So, right, if you are depressed, what can we do to help lower that depression? Well, we can think about what thoughts are you having that are making you feel depressed, and how are those making you feel? Are there certain behaviors you're doing that are maybe continuing these feelings of depression? These kind of things. And so if we change some of these, we might be able to relieve some of these symptoms. But you'll notice that that doesn't necessarily get rid of the depression. That just makes you feel less depressed. So, right, this is useful in the sense that it helps to change irrational self-defeating thoughts, but it doesn't always get at the actual root of the problem. So if you are anxious, if you have generalized anxiety disorder, cognitive behavioral therapy would help you to learn how to lower that anxiety, but it might not remove that underlying generalized anxiety disorder. But the idea between cognitive behavioral therapy is it changing your cognitions, changing your behaviors. So, an example of a question you might see here, imagine that Joan sees her therapist once a week, and during these sessions, she lies on a couch with her doctor behind her. Her doctor says, well, can you tell me about your dreams and help me understand their meaning? What about your childhood? We'd argue that this is an example of psychoanalysis, right? This therapist is using psychoanalysis because they are the neutral expert, having you lie down and tell me about your dreams. On the other hand, we've got Dr. Arcana, a psychotherapist who believes in being open and accepting, not labeling or judging, and listening to their clients without evaluating them. They are probably most likely using what we would consider as unconditional positive regard, right? You would consider this as being client-centered therapy, but this idea of listening to you, not being rude to you, just liking you for who you are, unconditional positive regard. Okay, so that kind of sets us up for psychotherapy. So again, going to see somebody, talking about your thoughts, your feelings, how you're doing. But on the other side, there's also biomedical therapies that we use here. And when we think about biomedical therapies, we are operating on the assumption that this disorder is caused due to physiology, physical causes. This is a medical issue here. So we're going to change you, your thoughts, behaviors, emotions, by affecting your biology, which when I put it that way sounds extremely sketchy. But it's the idea of changing, the neurotransmitter patterns in your brain. And the therapist isn't really a therapist. They're the medical expert here. They're the person doing the psychosurgery or, kind of managing this or prescribing you a medication. So the first type of biomedical therapy we like to talk about is the most shameful one. This is probably one of the most unethical and unacceptable things that we have ever done to people, if you ask me. And this is at least in the realm of psychology. This is the prefrontal lobotomy. So the prefrontal lobotomy is the idea that, right, you have 4 lobes of your brain. If I turn my head this way, we're going to separate the front lobe up here from the rest. And if you recall, the front lobe of your brain is focused on the majority of your higher level thoughts, what is going on your day-to-day conscious life. What we did was we stuck an ice pick up your nose or up into your eye, like this, and originally, we basically just scrambled the front half of your brain. To say that there were negative consequences for doing this is an absolute understatement. These people were changed forever, right? And this was done through the 40s and 50s, but eventually was done less due to psychoactive drugs. I mentioned this Fallout 76 location, Fort Defiance, this Trans-Allegheny Lunatic Asylum that I've been to before. And this picture I actually show because they used to line people up and perform lobotomies one after the other, and get these people to change their whole personality. So much so that this is actually what was written about a human being with a mental disorder. Right? That in some instances, the best case that can be done for the family is to return the patient to them in an innocuous state, a veritable household pet. Right? Simple schizophrenia patients make nice household pets after operation. A, before lobotomy, and B, 1 year after lobotomy. These people could do simple things like put on their clothes and follow easy directions, but they were forever changed, and they were not anywhere near like they would have been. An incredibly terrifying and awful thing that we have done. Fun thing to end on, right? Well, let's talk about another one, electroconvulsive or electroshock therapy. So ECT, electroconvulsive electroshock therapy, is the administration of an electrical current to the brain. Now, right, we're not walking up and tasing you or anything. This is a medical procedure where we are going to kind of lie you down. We might give you muscle relaxers, put something in your mouth, and more or less give you a seizure, right? Stimulate your brain with a bunch of electrodes. It's controversial, but it does seem to be effective. Individuals who have electroconvulsive therapy tend to experience lower symptoms of depression. This isn't the first case thing, right? We don't just lock people up, we don't just, say, oh, you're depressed, let's go ahead and throw you in here. Turns out that people eventually have permanent decreases in memory and IQ scores after having electroconvulsive therapy. Why is this effective? Why is it that we're able to reset the brain here? We have no idea, if I'm all honest. It seems to just be this case where we are doing a hard reset and it seems to be working. But I always tell people this because electroconvulsive therapy is something we still do. Your doctor is not going to lock you in a room and say, we're going to treat you this way, but it is something that is used if we've tried almost every other option. Finally, let's talk about drugs. Oh boy, let's talk about psychoactive drugs in terms of medications here. So the ones that we're really going to be focused on today are SSRIs. Right? So generally, this is going to be a class of drugs that are mostly used to treat depression and anxiety by working on the serotonin neurotransmitter, the happy chemical, as we talked about. Note that when you start taking a medication, say you've been diagnosed with depression or anxiety and you start a medication today, it's going to work in a month and a half. It takes a lot longer for these things to kick in than maybe some other medications here. So, and what is really happening is we are finding serotonin reuptake, reabsorption spots. So think all the way back to the biology of the brain and the fact that there are neurotransmitters in the synapse that can be taken back up. Well, what happens if we put a plug on this, right? And we kind of just stop you from putting this up? Well, then there's more neurotransmitters, happy chemicals, waiting to bind on your next neuron here. So these are very common. Lexapro, Zoloft, Prozac are all very common SSRIs. We can also talk about benzodiazepines, which instead of working on serotonin, work on the neurotransmitter called GABA. Not that that's super important, but these are things like Xanax and Valium. And these are going to actually lower some other parts of the brain. They are going to make it a little bit using a different set of neurotransmitters and actually cause a lot more relaxation for an individual here. However, right, I always just mention that, right, benzodiazepines are very dangerous. Don't abuse them. They're, right, I gotta just say that. One other thing I like to mention that's really cool is that there are emerging treatments. It seems to be that ketamine, formerly a street drug, has been shown to be very useful in treatment of depressions, giving people a small nose spray. Now, it doesn't get you high or anything, but it does work. Psilocybin, magic mushrooms are also something that there's research beginning to come out that says these are going to be useful in treating depression, anxiety, stuff like this. So that is everything I have to cover in terms of psychological disorders. But to leave you guys, one thing I'd like to kind of end with is some of the stuff that we've talked about over these last 13 lectures here. And right, if you think about psychology, and what I hope you've taken away from this is that psych is a science that is growing. It's useful. We're still learning why people do the things they do. If you're dealing with at least you and one, and not even another person, psychology matters. How things work, how we think. It's a big, big field. It's not just what we talked about in these last two chapters. It's more than just mental disorders. There's plenty of things that are available in psychology to do outside of that. I always tell people that psychology is a discipline where chances are you're going to end up with more questions than you do answers. And oftentimes the best answer is, well, it depends. I always tell people as well that psychology is a very young science. It's less than 150, even 200 years old. We're still learning things that we, haven't necessarily had time to fully explore. And most importantly, I always want to kind of finish off by letting you know that I'm a resource to you. If there's ever a question you have or anything I can do to help, don't ever hesitate to reach out. I'm always happy to do that. But I hope this course has been useful for you. I hope you've learned something, or more than just something, a lot of things. But again, I wish you all the best of luck in your future. And please, if there's anything I can ever do to help, don't hesitate. Have a great one. Good luck.